Good afternoon and welcome back. We will continue with the scientific sessions for the day. I hope all of you had a good lunch and is energized for the session now. I'm pleased to invite the next speaker, Mr. Aurelio C. Hammer. Mr. Aurelio is a sound explorer, musician, composer, cultural activist, currently based in Auroville, South India. Born in Austria, Aurelio studied linguistics and ethnomusicology before traveling around the world for 5 years, staying with indigenous communities on every continent and learning more about music and consciousness, harmonic science, and music therapy. In Auroville, he started his project of Svaram Musical Instruments and Research, a community based enterprise that designs and produces a large variety of innovative musical instruments, artistic sound installations, and federal states educational programs. Welcome, sir. We are really looking forward to your session.
Good afternoon, everyone. While the conference is centered on healthfulness, I guess that we're all a little bit full. And so fullness, yeah. And so I thought actually in the terms of well-being, it's very important that we listen to our cycles. There are cycles of well-being. There are cycles of activities. There are cycles of rest. There are cycles of absorption. Very important. I did some beautiful study with some colleagues in Europe on chronobiology. There's a whole science of all the different rhythms in the body. And so I would like to respect that early afternoon, post-lunch time. And for this purpose, one aspect of music is the community building aspect, being together in sound. And I will share with two of our young students. We will basically share some specific sounds of different textures, different qualities, different traditions. And it's actually combined with a little bit of a study work. I'm actually building on the foundation of those two amazing scientific lectures we heard in the morning and presentations. So I said, I can afford actually to spread out a little bit of an experience, a direct experience, but also combined with a study. So I'm inviting you, we will go through a small choreography with different sounds. I'm inviting you for two things which are a little bit of a paradox, but we're working with an integration of our different brain capacities. So one thing I'm inviting you, that while you listen to the sounds, we can listen deeper if we close our eyes. Yeah, because then that brain center is not active. Not yet, we're not yet there. I just introduce it. So if we close our eyes, our body, and if we're in a restful mood and digestion, rest and digest is going on, we're automatically in the parasympathetic nervous system, which also slows down the brain waves. We come into a default mode network, and we can basically, we come a little bit into a daydreaming. That's the proper thing in South India. What we do after lunch, we have a little bit of a siesta. Yeah. So that invitation is there, that you close your eyes and you invoke. We heard the Bonnie method works with music and imagery. Yeah. So to see, are there images actually you're receiving while hearing the sound? That's one task, and that's basically, it just happens naturally. But the task I'm setting you at the same time, what are the different qualities of sound? Which sound is resonating with you? Which sound is possibly challenging you? Where you feel an affinity with it? Which sound is more difficult to take? We have some instruments which are used. My main academic study is organology. It's the science of music instruments. Yeah, and I worked over the last 40 years really with all the musical cultures of humanity. And in our studies, we went back to the origin of music making. I've spent quite some years with Aboriginal people, with Native American people, with Maori people, I spent 2 years in the Pacific Ocean. I ended up in Papua New Guinea in Stone Age. And my interest was, what was the beginning of this music making? So we have some instruments from different cultures, where some instruments are sometimes used to protect the community. Some instruments are used to invite all the goodness into the community. I have some branches here in Austria. We have in Middle Europe, we have those old trees, a 1,000-year-old oak tree. And actually it so happened when I usually go to Europe, I visit those old trees. They are kind of part of my family. And then one branch fell from the tree, and I brought a branch from the 1,000-year-old oak tree, which was used 800 years ago. We have documents that the tree was used as a communal council ground. Yeah. So for me, the instruments have different stories. We know in music, how to say, in the pre-European history, that instruments were actually used as their real instruments. They were allies, they were friends. We had a relationship. And when I came into Indian culture, it was so beautiful. In the stage work I did for many years soundscape for theater. But each time when we came on stage or you touched an instrument, you first have to take the respect of the instrument. So that was a very beautiful gesture for me. And I said, yes, we have that in the ancient cultures also. Okay, so we basically will share those little helpers we have with us. You're invited to be with this process which is going on here. Some nice digestion. Sit back, relax, yeah, and see what maybe it will be a 50 minutes or something like this. Just dream with it. You're invited to dream. At the same time, you sense into your body sensation. How are those sounds meeting you and resonating with you? Just very gently being with yourself. Take a moment of reflection, sensing in and through your body. That one basic vibration which is always with us throughout life. I was recently with a person, she was 96, there in a heart clinic and seeing her heart pumping. And I said, wow, almost 100 years unceasingly, this basic pulsation of the heart, speeding up, slowing down, naturally following those cycles of life. Okay, we hopefully could manage to invite you into a bit of an inner space. Let's see how we can harvest it. Just be gentle with your body, feel your hands, feel your fingers, possibly take some refreshing breath, really rub your fingers, invigorate yourself a little bit, and let's see what we can harvest from this session. We are in an academic institution, so in phenomenological studies, we dive into experiences, and then we see actually what was happening, what is happening. So if somebody gives us some light gently back, step by step. The first question actually I want to bring into the room is imagery. Yeah. And we want to harvest actually a little bit from the auditorium, because we want to explore the principles of this music therapy. What are these building blocks? What makes all those different effects on our being? I will just, let's say, yes, here we are, imagery. So, okay, there's something else on the board. I don't know from where it's coming. Okay, maybe we don't need it. I just wanted to note it down. Let's keep the note. What were images? Whether anybody could work with images, please. A forest. So a forest was there, a journey. Any other image? Yes. Water. There was definitely water there. Raining. Yeah. So we worked with different elements and we worked with different stages. There was real water there. There was rain there. There was ocean sound there. Yeah. Yes. We worked with three different gradations of wind. I'm not sure if you're aware of it. We have, with all those hundred thousands of instruments we created over the last 40,000 years in humanity, we can bring them together only in 4 families. Yeah, so we definitely, the first, after the heartbeat, wind was there. We just had pure breath, then wind, then storm sounds, and then bringing that wind into a form of a flute. Yeah. So basically, yes, natural images, nature. Anything else? Yes, please. Being in community. Beautiful. You felt the human aspect of it, no? Nature is there, and we are that specific species in nature, no? With the capacity, we are social species, which is so important. That's why music therapy is so important, because it can bring in these very difficult situations, what we heard from your research with the bone marrow transplant. It brings the humanness, it brings the human contact much better if it can happen with the help of the family. Fabulous research, actually. Yeah. Yeah, we had a bit of the fire also. I used those symbols from Tibet, yeah, which are basically, how to say, they have a very specific function in the ceremonies. I don't know if anybody remembers in one of the first presentations which we did with Mrs. Bharati when she was here, I'm talking like maybe 12 years ago, in the big auditorium, we had our sound bed there, and he volunteered, and then he got up from the bed and had a very deep experience. Not only ancestors, he basically had a conversations with his recently deceased father. Yeah. Through simple sounds. So my inspiration, we can also start to work on the PowerPoint if we get the screen. Yeah, I have some images. It's not only playtime. Yeah. Yeah. So big, you know what, very interesting, we always say when 5,000 years ago, 7,000 years ago, when humanity invented metals, what was the first use of metals? We think of weapons, you know, or hunting. For hunting, basically it was used, but also for agricultural tools. But the first, in the musical world, the first use of metals were actually to protect the most precious things people at that stage of development had. And what was that? That was domesticated animals, was the livestock. So it's fantastic. The first oldest instruments besides stones, we meet actually metal instruments from livestock. Yeah, so you heard correctly. Okay, so we have, let's say, we see how close sound works with memory associations, no? When we had presented on the World Congress of Music Therapy 2014 in Austria, if you remember, which was so beautiful because the question came up in music therapy about inculturization. Is Western music therapy with Western music, is that appropriate in other cultures? So that aspect, because music works with memory. Often I have, for instance, young couples coming where the mother is in pregnancy and says, oh, what would be the best for me to listen? And that depends what's the cultural background of the mother. So it came up today also that in music therapy, you said it very beautifully, it has to be customized. We're looking at the whole being and its environment. Yeah. So do we have some images? Where do I direct it or? Okay. Yeah. We not? I had given you the PowerPoint. Is it possible to connect? Yeah. Let me just check in the auditorium. Was there anything kind of like which was difficult for you to take? Yeah. Very important comment. Basically, how to say that music can be very physical. Yeah, it's very closely, as we heard today, related with the motoric center also. Yeah. So in how to say, when I had been studying music therapy in Salzburg, University of Salzburg, 35 years ago, 40 years ago, I needed to understand what makes it happen. You know, what are the principles in music? What are kind of like really functionable? Yeah. Okay. And how do I transport it from? Yeah. Okay. Okay, so what I want to share a little bit, what came over the last 30 years, kind of like in our research. That's it. Can we have it full screen? That's it. Now, I feel very blessed actually to be able to work in the context of India, which possibly harbors, how to say, the most ancient and deepest treasures of humanity. We feel like India is the cultural container for the ancient wisdom of humanity. And I recently only found that image, basically that when I said, this is our home base. Very interesting that already in the image of the galaxy, that's the Milky Way galaxy, that it's actually two-pronged. Yeah, it's not kind of like has a center and coming out. It has two sides. That means part of our home. It's very clear that we are living in a field of duality. And in our work, the duality expresses itself basically between sound and silence. We experience often in our treatment modalities that the time of silence after the treatment is as important as the actual intervention. Yeah. So in the Indian system, how to say, in the silence, that's the image of it is Shiva. He's in this resting position. He's above the world. He's actually not involved. His pure beingness, and he represents also the still point. Yeah. In what attracted me to India was the concept of Nada Brahman. The whole world is created through sound. Everything is in motion. Everything is in the process of becoming. And I think very important in therapeutic work actually to understand the role of the stillness. There is the action, there's the intervention, there is the research. What about the deeper reflection, the absorption of the work we're doing, the absorption and the time of assimilation for the patient? Okay, let me try. Where do I point it? Here, here. Okay, no, I think we can skip that. There's a little bit video. Yeah, we can skip it. There was sound with it. Yeah. So very interesting that in that concept, what we found out of many years of working, first we had this idea that we only want to harmonize. If somebody is in disease and somebody is suffering, we want to harmonize that situation. We want to bring all sweet sounds and all of that. But we realized working, especially because the people who come into music therapy and sound therapy are often people with chronic diseases and with deep-seated traumas. And that's why then we realized actually, and we have even in a minimal setting now in the healing cave, there are tuned sounds and there are untuned sounds. Yeah. So we have two expressions of sound. Ordered sound is basically music, is the world of music, and not ordered sound is noise. Yeah. In one of the latest series of music therapy, actually, it was about 10 years ago. It was an American researcher also. She presented so beautiful that the only way possibly we can explain the working of music is that music is like the whole creation. It's a chaotic system. It embraces chaos and order. And it was also said today already that when we are in disease, actually was the vice chancellor saying it so beautiful, disease, we cannot be done with it. It is a part of our evolutionary process, of our personal growth. Yeah. Often I see when you work with people with chronic diseases or in cancer, if they manage to integrate the root, how they came to that place, it's a big transformation. Yeah. So we realized in our therapeutic approach that we need not only perfectly tuned elements, we also need like the rattles we had and all different kinds of sounds to touch into those layers which are unconscious, which are not spoken of. So those chaotic sounds, the noises, the primal elementary sounds often help us to touch those dimensions. Okay. Yes, I think we can move forward. So that balance also in the healing work to find between setting something in order and giving space for the organism itself to work. Basically, in the yogic science, how this polarity expresses itself is through the expression of the lunar and the solar energies. I've been in a transmission of a doctor of the Dalai Lama. That was about 7 years ago. And he was just, we thought we get this great introduction to Tibetan medicine, 3 hours lecture, 45 minutes were spent with chanting, with invocation of the medicine Buddha. And then basically he said the only thing, if he manages to convey to the audience the most precious thing, if we understand the duality of the lunar and the solar energy in our body, in our systems, in society, in our creation, this is the key to healing in all its expressions, which we have kind of like labeled here. So very important also in the therapeutic context, the active phase, the involvement phase, the preparatory phase, and then the stepping back from it, the letting it happen. With the body is a self-organizing, self-healing system. It adjusts itself. We even saw it in this big, largest being, our home, our planet Earth, Gaia. If you remember in the lockdown times, how quickly nature regenerated itself. We stopped for 1 month with our flying around and polluting the planet, and the animals came into the American cities. And in Delhi, for the first time, they didn't even know that there are mountains visible from the capital and things. Yeah. So nature has this amazing self-resilient, self-correcting capacity. Yes, next. So in the traditional systems, then how that maybe we often in our worldviews, we are stuck in this polarity. So from the two oldest medicine systems that we have in humanity, it's the Chinese system and the Indian Ayurvedic system. Basically, they had an insight of the five-foldedness of our being, which is so beautifully expressed in our hands. I'm always saying if we understand that those 5 elements which we carry in our hands, that's another very precious key. And as we have it on the earth, we have a physical body. We have the densest parts of the body, yeah, our bones, the mineral structure of the body. We would call that the geosphere of the planet, yeah. For to touch the bones, we use very specific instruments. Yeah, we use dense instruments. We wood-grown wood, for instance, no? The next layer of the body is the biosphere of the planet. Yeah, the life energy. That's where, how to say, where all life is originating. And even we call in the planetary context, we talk about the thinking sphere, the noosphere of the planet. Yeah, and above the planet, the planet also has even a subtle body, the atmosphere, the stratosphere of the body. And the different qualities. We don't need to go into it so beautifully and so elaborately explained in the Ayurvedic system. Yes, we can look at the next. So we are so fortunate that we have this 5,000 years of medical research basically with us. We heard from Annie so beautifully today, music as a resource. I was called from New York about maybe, I'm not sure what it was, like 15 years ago. I got a call from somebody, New York University Music Therapy Department. Some Israeli friends were there. And they said, hey, Aurelio, we were approached by United Nations. We're working on the Sustainable Development Goals. And we realized that there's a missing element. What makes human society? What makes human culture? It's music, which basically is that unifying social thing. So they started an initiative, music as a global resource. Svaram was one of the first 50 projects which was invited in that space. And basically there already it was beautifully laid out what are the roles of music. Music can help in community building. Music is very crucial in health. Music is there in education, in environmental awareness, and in the alignment to the sacred core of the being. So we've been working over the last 15 years. It's fantastic. Now there's about 150 projects all over the world registered, people who worked after the Hurricane Katrina. There's so many beautiful music projects. And my aim here in that institute is to bridge that world. We also, Svaram is part of the Forum of Sonic Ecology. So I'm involved in all those different works, and I'm so happy that we can associate it with a scientific medical institute. Yeah. Yeah, again, we have such a great layout over, we have the chance of banking on the wisdom of the last 5,000 years and the insights of the human system. I had asked some of the foremost quantum scientists, which we had in Amit Goswami. He's of Indian origin. He calls himself a quantum activist. He's 85 years old. And I said, sir, what shall be my focus in the research of sound and its impact on the physical body? And he said, just focus on the koshas. Be aware, focus on the layers of the body. Yeah, we in our materialistic scientific paradigm, we look at the chemistry and the physicality of it. But we know that there are different layers. And we, of course, in music therapy, that's the first thing we encounter is the emotional body, the vital body, yeah? The energetic body of it. And then we come behind it, we see those things which are happening in the mind sphere. And we can only, I think that's the gift of music therapy, that we can approach the whole being in all its expression. And thanks God, there's some very assiduous people who follow the scientific research and work on evidence-based medicine. It's very much needed because basically we have the chance of connecting those ancient wisdom traditions, with the newest of science. And it's so fantastic here in this institute that yogic science and all this knowledge of the musical tradition is there. so beautiful for us. One of the key texts in India is Sangita Ratnakara from the 12th, 13th century. And actually, Sangadeva, who wrote it, came from a medical family. Yeah. Okay, I think we can move. Let's see what still is there. Yeah, this just expresses basically that research in the role of music has been going on since the beginning of humanity. We know now that even before Homo sapiens, actually, even Homo neanderthalis used already music and had rituals. Yeah, we have stone instruments from those things. So we are basically, I'm always saying, possibly one of the oldest medical instruments we have in humanity is a simple rattle. I've been in situations with Stone Age people where we were like maybe 3 hours walk away from the village. We were cultivating some in the rainforest. Somebody broke their leg, had excruciating pain. You know what? It from that village it took 2 weeks walk to the next road, and from that road it took another maybe 8 hours drive to the next health station. So what do people do there? They used twigs and rattles and calmed that person and sank that person into a trance so that we could transport her back to the village. And when I saw that, I said, well, how did it happen? That person was shouting with excruciating pain through the help of some leaves and that sound. And then, of course, the people started to chant around her. And suddenly, when I saw that, I said, wow, the origin of medicine, yeah, of immediately life support in that situation. Yes. Those are some of the modalities we are working. We work in one-on-one treatment settings. We have basically a sound healing room, which the core piece is like a big monochord tambura where people lie on it. And then there are all tuned instruments around it. I will not go into it. We work, our specialization is actually ancient tuning systems of humanity. When I realized that the Western musical system of pianos and guitar, which is now basically through the Western imperialism spread all over the world, was only codified 300 years ago. But we have scriptures of 2,500 years ago of the Indian original music system. And then I was interested, what were those musical systems? So basically they are just intonation, harmonic-based tuning systems. And that's what we use. We feel like they are more effective in the treatment of the people. So the basic processes are invoking the relaxation response. Yeah, and if that can happen, especially with people, even how to say, people who I work with people who have cancer and they have nobody anymore to go to. And through that process of relaxation, they sink deeper, things come out in them. I had some amazing experience. It's all kind of like subjective, which we have records of it, but it was not in an institutional place. But it's astounding to see always when people have the chance of coming to the root of their crisis, of their healing crisis, and that unless it's really advanced in physical stages, that possibility of transformation. I think we're almost through. We can jump the next two ones. Let's jump over this one. I don't know actually timing. So basically, again, the two main function is a calming, lunar relaxation way, which we anyway have to do with every patient when we want to create that field of trust, create that security. And then the possibility of actually coming in with a solar stream of energizing the system. Okay, we talked about that possibility of transformation. For me, also very interesting. We work in group settings with specific themes. We work even in the public field, how to say, sometimes with 80 people in one sound journey experience. We did some studies more on psychology, some qualitative studies with questionnaires and processing after the sound journeys. Yes, next one, yes. So the question is for us, Svaram is a little bit of a place also of wounded musicians. Very interesting. I had over the years so many people who worked in symphony orchestras and who were so stressed out being there. And also we work with many therapists who have burnout syndromes. You know, when you're in the giving profession, you have to be very careful how to keep the balance of your own system. So I just wanted to basically, I guess that everybody is studying here in the medical profession. And the question is, how can we bring that awareness of sound into our own space? And there are three ways. The beautiful thing, we have the tradition of Nada Yoga, Nada Upasana, where we basically bring the sound, we listen. It has two stages. The first stage is listening in pure silence, in a receptive voice of meditation. We listen to all the sounds around us. That can be a process of deepening. There are many descriptions in the scriptures of what are the different stages of the sounds we might encounter on the journey. And then basically, I think one of the keys in self-healing for me, as simple as it is actually, is humming. Humming, almost we all do it. All the mothers do it in lullabies. Whenever a child is hurt and stuff, the first thing is always that we hum to the child. Every mother has this instinctual quality of working with children. And the next step, so humming, actually, we spend hours of practicing humming. I have people who can bring their hum into the little toe. Yeah, if you practice this with any ailment, with any tensions in the body, there's a possibility of working basically with your own vibration in your body. And the specification then is actually toning, where we basically bring the hum into the expressions of the vowels. Yeah. So that's basically one step for self-practice. And then what we wanted to share with you is the gift of all those different instruments. It's so beautiful in music therapy how people come. You have a young student now who comes from percussion, from traditional Kerala percussion. This institute, I think it was a world premiere, hosted a student from Korea, and she was playing her didgeridoo in the clinical wards in India. It's a complete paradox, actually. It was incredible. So the very important, basically, from the practitioners in music therapy, what's your relation? What is your prime instrument? How can you deepen that contact with the instruments? How can you cultivate it? Because I'm always saying the teacher is actually in the music. Every musician knows what the more time you offer into your instruments, the more you learn from the instrument. And it seems also there's almost a self-learning teaching capacity within sound. And the beautiful thing is also, that's why I speak about of an instrument mandala, basically because many of the young people, or even if you go in wards, your guitar might be the first instruments, but it's useful to have different sounds, a little bell and stuff. And so it's kind of like any surgeon has their toolkit, the music therapists also basically need to have their own toolkit. Yeah. Okay, so that's basically with the helpers. And this is basically when I speak about phenomenological approach to the sound work and to music therapy. Lots of it is basically, it is in self-study, in observation. We know nobody of us would be in this profession if there's not the basic core of compassion there. And that capacity of opening into something else than our own world. No? When that's the gift of music therapy, that I can be with people and completely, I'm just maybe listening is already so much worth. Yeah. And sensing into the situations, how to develop this capacity you are trained in the institute. We need the logical, factual, mathematical capacity to do the studies. But when we are actually in the encounter with the patients, we also need to have an approach to intuition. We have to be intuitive in that moment. Often the crucial moments, we don't know how they are decided. Yeah, they come out of the field of the encounter with the patients. I think that's it. Yeah. This is just a bit of an integration. We had that also so beautifully. I was very happy to hear today that actually music it's a craft. We need to develop the skills of music. Yeah. Music is an art. We have to be intuitive with it. And music at the same time is a science. The tunings which we are working in our sound healing room, they're basically all based on a Pythagorean paradigm. We're working with the mathematics of music. I think that's it. It's very beautiful. We have basically, I'm saying, music is in our hands. Music has to be in our hearts. It has to flow from our heart. And we have to fully understand how music works and what music is doing. And this was so beautifully expressed in the Sanskrit paradigm, of which we had, of the first part, we had such a beautiful presentation today, or a little intro with Dr. Nand. And the talam, yeah, that's science and the practice of rhythm, and then the whole science of svara, of frequencies and melodies, yeah, and usually what makes a good song. There's lots of music therapy interventions with writing songs and creating songs and singing songs. Whereas at the lyrics of the song is often then, we don't work with the patients with the lyrics, but we work with an intentionality with the patients. Those are the expressions of nada. The wave is there, all this magic of the movement. Yes, last image. And not to forget that in all of this, there is also a bindu, a still point. Thank you.
Thank you, sir, for that very refreshing lecture demonstration.